So for anybody who's watching the video online, thanks for joining us for today's Project Horseshoe Farm Community Health Fellowship info session. I'm Jason Roberts. I'm the Associate Director for Outreach and Communications in the Office of Fellowships, and I'm the advisor for the Project Horseshoe Farm application. And we're joined today by Ryley Boddeker-O'Connor, who is a current Project Horseshoe Farm Fellow in Marion, Alabama. And I'm going to turn things over to her now to walk us through the ins and outs of the fellowship experience and the application process.
Awesome. Thanks so much. Hi, everyone. My name is Ryley. And as Jason said, I have just started up my fellowship at Project Horseshoe Farm at the end of June. And I graduated from Northwestern this past year, and I majored in social policy and CESP. Also did a minor in legal studies and the civic engagement certificate. And yeah, I'll just start getting into our little presentation. So Project Horseshoe Farm is a 501c3 community health nonprofit organization. It started up in a little town called Greensboro, Alabama, back in 2007. And our mission, as it's stated here, that you can see, is that we want to build on the strengths of communities, improving the health and quality of life of our vulnerable neighbors, and preparing citizen service leaders for tomorrow's communities. So I would say that the three main pillars of our mission that you saw on that previous slide are service, community, and leadership. So in terms of service, we're working to serve vulnerable members of the communities that we volunteer in. And those vulnerable members include elderly folks, folks with various mental illnesses, those who are socially isolated for various reasons, as well as children and those of low socioeconomic statuses. And then for our pillar for community, we believe that community is a really important part of creating change in an area. So we hope to build off of the ideas and values of the local people in the area, and try to partner with other existing organizations and other strengths that communities have to be able to provide services to those vulnerable residents. And then lastly, leadership. That's kind of all of us, the fellows. And so really we get to develop a lot of leadership skills of basically learning how to run a nonprofit, and kind of preparing us for the various professions that we might want to go into, most of them involving some sort of healthcare related field, whether that be going to become a doctor, or some public health career, or social work, which is my main interest in doing this fellowship, which I'll get into a little bit later. But we have a lot of kind of input as fellows in the day-to-day running of this nonprofit, and we are basically what keeps it running. And so to talk a little bit more about each of our sites, we have 3 different sites. The first one being, as I mentioned, Greensboro, Alabama, which was established in 2007. And so it's just about a half hour or so from Tuscaloosa, if you know where that is, about at the University of Alabama's campus. And that's usually where our biggest set of fellows are, just because it is kind of where we started up. It's probably the most built out site. Here's a picture of all of the community health fellows from last year with our founder, Dr. Dorsey, kind of in the middle there. And yeah, it's just to kind of get you a look around the town, see what a small rural town in the South looks like, if you've never seen one before. But yeah, that's a little bit about Greensboro, also the catfish capital of the world. There's a lot of catfish there. And this is our Perry County site. So we are technically located in Marion. That's where I am right now. But we call this the Perry County site because we also help out with some other towns that are located in this county, which is actually just the neighboring county over from Greensboro, where Greensboro is located. And so those are the fellows that were there last year as well with Dr. Dorsey. And then these are, so it's also where Marion Military Institute is. So there's a very, there's kind of some prominent, there's a cool like kind of campus that they have there. This is right in front of the courthouse. And in both of these towns, there is a strong civil rights history. They're both located in the Black Belt. And so it's kind of part of the March to Washington from Selma to Montgomery. Martin Luther King March in the 60s. So a lot of really rich history there that contributes to some of the work that we do. And then we also have our Pomona site, which was most recently established in 2020. And so this is kind of outside of the main Los Angeles area, but it's still located within Los Angeles County. And it's located in the Pomona Valley and an incredibly diverse area. They kind of have this thriving downtown strip that the fellows are hoping to kind of continue to revitalize with some of the work that they're doing. And I think these are actually the current fellows over at the Pomona site that you can see pictured here. So to get into the actual nitty-gritty of what we do in this fellowship program, it's designed as a gap year between undergrad and medical or graduate school. So again, that could be a lot of the folks that do this program hope to go to med school after the fellowship, but for me personally, I'm interested in social work, so I'm hoping to get my master's in social work after this. Other people might be interested in doing something more policy-oriented, public health-oriented, but it is designed as a gap year program of if you don't want to go to grad school right away and you want to get some direct service experience, this is a great opportunity. It happens or it occurs around 13 months. You do get housing provided and all of the utilities included. So that includes air conditioning. All of our sites now do officially have air conditioning. And yeah, you don't have to pay for any of those aspects of it. And then we also get a monthly educational stipend, which I would say from my personal experience in the couple months that I've lived here is a livable stipend and will get you by in the towns that you're located in. So that is meant to reimburse you one for the gas that you are using during the fellowship, as well as paying for meals and basic needs like that. You also get 18 personal days on top of all federal holidays off. So those 18 personal days are up to your discretion to use throughout the 13 months. And then one of the main requirements for the fellowship, or main logistical requirements for the fellowship, would be that you do need a car and a valid driver's license. And the reason for this is that in a lot of rural communities, as you can imagine, they're not necessarily very accessible. And a lot of your job, or it's not a job, it's a volunteer service experience. A lot of that will be driving your health partners, which I'll get into later, to various doctor's appointments, as well as just various things that you will basically need a car to get around. So that's the reasoning behind that. And now I'm kind of get into, before I get into some other things, I'll also mention that we do have internship opportunities. So let's say you're not a senior right now, but you're a junior, or someone that's a junior, or anything in between that. We do offer internship opportunities kind of on a rolling basis for really any period of time, as long as it's at least a month long. And housing is also provided for interns. And yeah, start dates are flexible. You really get to see, get a unique window into what fellows do. You get to kind of go with them to a lot of appointments and just help out in various ways and get a good insight into the program. So that's a really good opportunity if you are not sure about the fellowship, or you're kind of early on in your process and want to try out an internship. So Project Horseshoe Farm and Dr. Dorsey, who is a trained psychiatrist by profession and the founder of the organization, really goes by this biopsychosocial model that guides a lot of our work. So you might be familiar with this if you've ever taken any sort of, I don't know, maybe global health or really any sociology or SASP-like course at Northwestern. I know this was somewhat familiar to me, but something that I really identified and appreciated about this organization is that we really think about an individual in the context of their community and how we can support them in living a better life. So it's not just about the individual, but it's about the community and fostering connections between the community and the individual that are going to help a person succeed. So you can see in the middle, we have mental health, physical health as those important immediate things, but there are lots of things that can impact that kind of on the outside in terms of healthy relationships, access to transportation, healthy behavior, spiritual life. And then kind of outside of this, in this other circle, we have, all of the different systems that individuals have to interact with, like nonprofit services, food systems, the healthcare system. So we try to operate kind of within all of these levels and to help connect individuals and kind of reform the social fabric of a community so that individuals can thrive. So there are three kind of big aspects to what we do as a fellow. So we have our community programs that we run. We have Wednesday engagement sites, and then we have what are called porch outings on Fridays that help give us some broader engagement in the community and some team building. And so I'll get into each of these. So first off, our Health Partners program. And so our health partners, or actually before I think there's a next slide on this, but just to give you an idea, we have our Health Partners program, our youth programs, housing programs, and our community center. So in terms of our Health Partners program, really what we're doing is helping folks navigate the healthcare system. And so usually the folks that we are paired with for this are elderly adults, but it kind of ranges depending on certain health needs that other younger adults might need as well. But we really help them with a lot of things. So for some of my health partners personally, a lot of what I do is taking them to doctor's appointments, helping them keep track of their medication, helping them keep track of their social benefits, such as Medicare and Medicaid, and what's covered. And so that kind of gets into the social services. For other folks, a lot of it is really just companionship for folks that are isolated, do not have a lot of family members or a lot of support in or outside the home. A lot of what folks need is just someone to talk to or someone to just give them some structure in their lives, whether that's just playing a game of Uno or getting them to take a nice walk outside or various things like that. Helping them with their finances, kind of balancing budget and things like that. And then really just helping them identify some health goals that they would like to achieve that you can help them work towards. And yeah, here's just a couple pictures highlighting some folks working with their health partners on various things. And you meet with your health partners once a week at least for about an hour, and usually have kind of 8 to 10 health partners that you work with. And so a lot of your day and a lot of your week is structured around kind of you finding time to meet with those health partners and start forming those relationships. And really above anything else, what you are doing is forming relationships with them. And I think everything with the health goals comes second, because you have to form that relationship in order to build that trust, in order to help them reach their health goals. And then next is our community center program. So this is something that we run either 2 or 3 times a week, depending on what site you're at. And this is in the mornings, mostly for our elderly and other vulnerable adults, to help, like I said, give them some structure in their day. So usually the structure of the program works by, well, first we provide them transportation for a lot of them that don't have cars or do not have a good way to access our buildings. So we coordinate rides to drive folks into our community center. That's actually where I'm sitting right now, in this big open space. And we like to do various different activities with them, and just to help them kind of build relationships with themselves and with us, and just to really kind of have a good time and a good, relaxing or distraction from the rest of their day or anything that's going on in their lives. So a lot of older folks like to play dominoes. So that's what's going on here. I've learned how to play lots of different games in the process of this. Various different arts and crafts. People really like working with their hands. It can be a really relaxing thing. Or getting them up and moving. We have some exercise equipment in our facility that some folks like to use as well. And we also serve them a light lunch at the end. And we are responsible for cooking that. So that's been a really fun experience to kind of learn how to cook for a large group of people, and kind of work together in doing that. So that has been a good experience as well. And then our youth program. So we have done various things with our youth program, including in the summer, we've done a summer program about 3 times a week for 2 hours, where we do some kind of structured academic time, and as well as some just kind of fun activities and snacks for the children. And then our kind of main thing that we do with youth is power hours. So we actually go into the classroom for about 2 hours, either 2 or 3 times a week. And we usually work one-on-one with students who maybe need a little extra support, usually second and third graders, either working on some homework that they have for the day, or doing various different kind of academic activities with them, and building a relationship with them to help support and give that one-on-one time. We know that in under-resourced schools that the teacher to student ratios are often pretty poor. So we are hoping to supplement that by some of the one-on-one attention and kind of tutoring that we give students to also just help them feel like they have the attention and support that they need. And then we also have housing and nursing home programs. So in our main site in Greensboro, we have an enhanced independent living facility for specifically women with various mental illnesses. So the goal of that facility is to provide housing and monitor complex cases of mental illness, and to reduce hospitalizations and the cost of healthcare. So trying to kind of prevent things before they spiral. And so if you are a Greensboro fellow, you work a lot with the ladies in this home, kind of on a rotating basis to help with various things, including cooking and cleaning around the house, adherence to their medications, as well as transportations to do kind of fun activities outside of the house or inside the house. I know they really like doing karaoke and fun things like that. So that's an example of what they do in Greensboro. And then in the Perry County and Pomona sites, we go into the nursing homes for about 2 to 4 hours a week and visit some of the more isolated members there. And we also lead some kind of guided activities in their community center areas, just to help give some folks some extra support and attention in those facilities. And we also have Wednesday engagement sites. So you are placed somewhere, either in some sort of nonprofit or government or various organization in the community, to help out and kind of learn more about that aspect of the community. So for example, my Wednesday engagement site is at the local library. So I've been helping the librarians with various tasks there, and they're very connected with a lot of the youth programs and some of the pre-K programs I'll be supporting that they do. So it's been really, really fun working with them, learning about the Dewey Decimal System, so many things with that. But and some people tend to work on a farm or do various other kind of engagement sites in government organizations, some EMS services for folks who are particularly interested in medicine, and things like that. And then, yeah, we also do very so on Fridays, we usually do some sort of excursion to help get more connected with notable members of the community. We've met with the superintendent of the school districts here, and various other small business owners. Folks have also helped volunteer with some of our firefighter and emergency services. We did an obstacle course with the folks at the Military Institute. And yeah, it's just another way to kind of learn more about the community and build some teamwork between the fellows that you're working with so closely. And yeah, these are our application deadlines. And so we have our fall deadline coming up next month. And then we also have our spring deadline coming up next February. And so either of those are a good option depending on kind of what your timeline is looking like in terms of applying for postgrad opportunities. And I'm also going to put a link to, well, I'll do it after I stop screen sharing, but I have it, to our website, as well as the application link, which includes kind of all application questions that you'll need to answer. And yeah, and you can always contact us here, or I'm also going to put my email in the chat if you end up having questions outside of this, but I'm also happy to answer questions now as people have them.
Thank you, Ryley. That was very helpful. I can kind of lead this discussion a little bit because I know a lot about the program, so I know that the questions that students might commonly have in mind, but I think it would be much more useful if the students who are attending the info session got a chance to ask the questions that they want to ask Ryley so that you get that real direct feedback on what the experience is like. So I would love to know if anybody in the info session right now has a question they'd like to ask Ryley. Oh, actually, there's a question already. Denise wanted to know if you can indicate a location preference on the application. Ryley, could you also talk about your process in making that choice and going through the interviews and how that worked out for you?
Yes, totally. So yes, the short answer is yes, you can indicate your location preference on the application. So between the 3 sites, there's also a little bit more information on the website on kind of the different sites that I would encourage you to look at as you're kind of making that decision. But at least personally for me, when I was looking at the 3 sites, I kind of had the approach where I didn't have a super strong preference because really at the end of the day, the kind of mission and what you're doing at its core is the same. So that's always something to keep in mind. And there's also, yeah, so there's various considerations that you might want to make there, but in terms of how I did that, you first send in your kind of written application with all of the written materials and essays, and then you go through 3 sets of interviews. And so after the last round of interviews, that is when they have you indicate your location preferences. And so I ended up, and you can kind of indicate whether or not you'd be happy with any of the 3 sites, but here's your kind of 1, 2, 3 ranking. Or you can say, I only want to be considered for, the Pomona site or whatever it is, if that, or I only want to be considered for these 2 sites, if that's what you're feeling. But I would also say that if you are interested in like only 1 site or only 1 or 2 sites, it would probably be something that you would want to indicate on your application of like a specific justification for why you're only interested in those sites, just so that that transparency is there. I also think that in the past, I'm not sure how much this is going to be going forward, but I know that generally for the Pomona site, they are mostly looking for folks who have some sort of background in Spanish, or at least demonstrate a willingness to pick that up quickly, I think is something that might be pretty important at the Pomona site. So that's just something to keep in mind as well.
If I could just real quickly add to that. So I feel like I learned a valuable thing the last time I discussed this with John, and that was that one of their top priorities as an organization is the flexibility of the people applying. And I didn't press him on this, but I think that what he meant was they want people who have an open mind about where their placement is going to be, and they want them to be committed to the organization more than the location. Now, obviously, the flip side of that is that there are certain challenges that come with living in the deep rural South that it just won't be there for you if you're in Pomona. And if that's something that you feel like you're not sure about, or you don't want to do, then I don't want to discourage you from starting this process. I just want you to go into it understanding that having a preference so strong for just one location is going to impact your ability to get selected for the fellowship. And I feel like as long as you have the right expectations, then the rest of it is up to you to decide how you want to approach that. But I do know that they are hoping for a person who has flexibility. I think that's also because of, the sometimes challenging nature of the job itself. So just want to make sure people are aware of that.
And I'll also add, I think it is a little funny too, just because there's a lot of aspects of this fellowship that you really just kind of have to do and live to understand it. Pictures speak 1,000 words. I was really glad that this presentation had a lot of pictures, because I actually feel like I didn't see wasn't able to get a lot of visuals before applying to this, but I'm still here. But but I will say that it kind of ended up feeling silly that I ranked preferences once I got here, because I was like, there's just no way for me to know like what the difference would have been or what the experience would have been like. And I really think it totally it just would have been a totally different but valuable experience at any 3 of the sites. Yeah, just take that as it is. It's really hard to kind of know what you want unless you do have like specific thoughts about or knowledge about a certain thing.
Thank you. So somebody else in the chat is asking about has it been easy to build relationships with health partners? Have you had difficulties in that area, and how do you problem solve? And what advice would you give to yourself now that you've had a few months of experience doing this? And then I would also just ask, in general, Ryley, could you talk about how central the health partners are to the experience of being a PHF fellow, and how that kind of organizes every day of your role?
Yeah, and that's a really good question and something that I think about a lot. So I'm glad you asked. So I am just over 2 months into the fellowship, and I would say that so you write copious notes as you're going through about your interactions with your health partners, and then you always think about what are your goals. And still, for me, a lot of my goals are still getting around like building a trusted relationship with this person. Like I said, that always comes first. So it really is a long-term process, but I would say that yeah, I mean, there's definitely challenges to it. One, you're not from the area. You come in not really knowing a lot about the area. Most of these people that you're working with have lived in this town their whole lives, and so are very immersed in it. Two, there's usually a pretty big age difference. And so, building a relationship with elderly folks, and also folks who, might be hard of hearing or have different kind of communication styles than you do, does take a lot of getting used to. But I found that in the same way that it is a long process, there also are certain moments that will just happen for you, that you realize, okay, I just made a breakthrough, or I can tell that this person is starting to trust me. And really, I think a lot of that is just consistency and transparency. A lot of these people are just wondering to see if you actually keep showing up for them, because, in the past, maybe people haven't, and they might be naturally distrustful of people because of that. And so really, it's just about you having a consistent, transparent relationship with them. And just sharing as much about you as you're asking them questions about themselves, to kind of build that relationship. Let's see. I feel like there's more that I wanted to say. What advice would you have given to yourself? I would say that just like embrace the awkwardness. I think there's a lot of times when like there's going to be some weird pauses in the conversation. Sometimes you're not going to know how to fill this like hour-long time with health partners, but you can. And honestly, sometimes like them just having someone to sit next to you and just kind of being there is still meaningful, and eventually you'll find something to talk about. I've gotten very good at small talk, and you can talk about the weather for a while now, because the weather's so unpredictable. It's not even really small talk anymore. So yeah, I think that's what I would say. Yeah, and just kind of meeting them where they are, and understanding that that you will have some like various cultural age differences, and kind of learning to work with that.
And Ryley, how does that work with the health partners sort of shape your day-to-day and week-to-week in the fellowship?
Yeah, so a lot of my week usually starts out with trying to plan when I'm going to see my health partners. A lot of them have various preferences for when they would like to meet, depending on what time they like to get up in the morning, or if it's a health partner that I'm usually taking them to appointments, that's a little bit more rigid. I know that I'm taking this person to the doctor at 10:30, and so planning around that. I would say that there's something else. Otherwise, Yeah, you just have to be, that's a thing that you have to be really flexible with. And you kind of have to it's kind of up to you to build that schedule. So I've kind of found that a little bit freeing, where you kind of, that's a way that you're able to kind of create your own schedule for the week. But it is also very dependent on your health partner schedules and trying to work with them. And sometimes there's weeks that they just say that they don't want to meet with you, and you also have to deal with that and not get your feelings hurt. And just continue to like be there when they're ready to be with you.
Yeah, I think that you hit on something there that I tell students all the time about this particular award. It's a really amazing mix of autonomy and responsibility. So the role is big and it's important, and you do a lot of really valuable work in that community, but you are trusted to build that schedule on a week-to-week basis. And there's not going to be somebody looking over your shoulder, monitoring everything that you're doing. I also think it's also really true that if you want something that gets you on the move as a job, like if you don't want to just sit in a cubicle for this bridge year, I can't imagine anything better than this, because you might be on the move all day, every day in this role. And so it's really, I mean, it sort of reflects the philosophy of the fellowship itself. Like it's an active, healthy thing to do as a fellow, because you are going to be out and about all of the time in this role.
Yeah, I think all that's a really good point. And it also made me think of something that you brought up in your question, Jane, was something that I also wanted to bring up. The other nice thing that helps alleviate some of the obstacles that you might think about in terms of developing a relationship with your health partners is, at least for the most part, there's a really defined transition period between the fellow who previously had them as a health partner that is, transitioning out of the role at the end of their gap year program, and your transition. And I've been really lucky, and I'm sure anyone who goes to this program will be very lucky to have fellows who have developed really good, trusting relationships after that year with health partners. Sometimes you get a completely new health partner, and then that's an interesting challenge. But when there is that transition period, because that other fellow has likely built up a very trusted relationship, once they are being introduced to a new person and they know that they're coming from the same place, there's a really nice kind of transition of, okay, well, if this person trusts them, then I should also trust them. And so that's also been really nice to see. And you get an overlap with the old fellows for about a month or 3 weeks or so. And so there's a lot of time for that fellow to also convey to you the goals that they've been working on, their strengths and weaknesses, things like contexts and things to keep in mind. And so you're not left in the dark. You're very well informed about kind of the relationship that you're entering.
So we had another question about the opportunities you have to build relationships with the other fellows. And I think it's a little bit about what the structure is that the fellowship itself provides. But then I also wonder, since we talked about this before we got started, Ryley, if you could just tell them about your living situation and how that obviously also creates an opportunity to build those relationships.
Yes, totally. So so in terms of kind of on paper logistical structural things, we have a Monday night discussions, which is kind of similar to a discussion section that you might have at Northwestern. But we have weekly readings that we do, usually oriented around, how to be a citizen service leader, how to work in a community, or like this week we're talking about various disorders, so like bipolar disorder, manic depressive disorder, all these things, and how to address those when they come up with our health partners. And so just super useful kind of materials to discuss, kind of in what feels like a classroom setting. So it's kind of nice, but very practical and helpful for the work that you're doing. So that's a really good time. And we do those, at least if you're in one of the Alabama sites, you do those jointly with the each site. So I get a lot of interaction with the Greensboro fellows through that. So we also, as fellows, you will live with the fellows at your site. So I actually live right behind here in some nice loft apartments behind this community center area. So I have a really quick commute to work, as I was telling Jason. And some of them have like direct roommates that you like share a room with. And then I actually have my own room. So that kind of depends on where you are. But So you're also, you're sharing a house with them. So you're working on the chores list together, you're cooking meals together, after work. So there's a lot of times to kind of bond. We were like playing a game of Monopoly the other night. So there's lots of things to do outside of kind of your hours where you are doing the fellowship. And then there's also some other like young folks in the area that you can connect with. So in Greensboro, there's a cool program through Auburn called the Roll Studios. They're like projects, so they're like architecture students, like third and fifth year architecture students. And they are placed here in Greensboro for a period of time working on like an architecture project, usually building a house or some structure in the community. So they're also living here. And they're really cool to meet and interact with. And they will often join us in weekly Wednesday night ultimate frisbee games that we do in Greensboro in this big open field. And that's a really fun time to kind of have some healthy competition, release some endorphins. So there's lots of opportunities to kind of do social things. There's also been Greensboro has a nice pizza place that does trivia on some Thursday nights, and they do karaoke on some Friday nights. So there's lots of fun things to usually do with the fellows, and we try to really intentionally build that out to kind of get some self-care and breaks from the work that we do. So
yes, thank you. Are there any other questions for Ryley? Ryley, I also think it's important to have a little bit of discussion about the financial piece. And also, I think it's fair to connect that with having a car. And, I get having a car thing is kind of a binary thing. You either do or you don't. But it is one of the things that is kind of a sticking point for some folks. And I wonder if maybe what you could do is just address how essential it is to have a car, that this is not the fellowship giving you some sort of arbitrary barrier, but that you couldn't do your job without it. So if you could talk just a little bit about how the financial piece works for you and how you're able to make that work yourself, and then how the car fits into the whole thing.
Yeah. So the stipend that we get each month is meant to cover gas and food and kind of other essential needs that you have. And really, I was also surprised by the amount of things that are completely covered under Project Horseshoe Farm that not even like you don't have to take out of your stipend. So like any kind of basic cooking utensils or like paper towels, like a lot of your basic stuff that you have to replenish pretty often is actually also covered under like a Horseshoe Farm credit card that you have. So that's something to keep in mind that I didn't actually even realize before coming here how much was going to be covered. And yeah, I would say in terms of the gas stipend that we get, I actually find that with my Honda Accord that's maybe a little more fuel efficient, that I actually don't usually spend all of the money that they give for like gas and everything each month. So that's a little bit extra that you can save. And all of this, because it's a fellowship grant, is not taxable income. So that's something to keep in mind. So it's really just for you to keep because it's a volunteer experience and not necessarily just a job. And then yeah, in terms of food and everything, I usually try to do some bulk trips to the Super Walmart that's about a half-hour drive away. So that's something to keep in mind, is that we do have, we're in a food desert, which is part of the reason that we have this program to kind of fill in some of the gaps in healthcare that we have around here, as well as very much a lack of public transportation. So that's why we are very essential in having a car to drive around our health partners, a lot of whom also cannot afford cars or afford the gas to use a car, or are, in various physical states where driving a car would not be feasible, and really to get in a car. And so I just went off on two different things, but and getting back to the groceries, I can usually do a pretty good job I've learned how to bulk buy things at the grocery store, which I was not used to at Northwestern. At Northwestern, I would just walk to Whole Foods and then buy the few ingredients that I wanted to buy for that night for dinner, because that was accessible and easy. Oh, I just got a thing that my connection is unstable. I hope you were able to listen to all that. But
I can hear you just
but I
fine.
would say generally,
You're frozen, but we can hear you just fine.
okay, good to know. And so yeah, I think with learning to budget a little bit more and doing more bulk buys at Walmart, I have been able to succeed with the financial stipend that they do give. And it is, I would say, a livable stipend, and especially with the gas money reimbursement, you are able to save some away as well.
Excellent.
Does that help answer what you were? Yeah, okay.
Yeah, for sure. I have in mind a sort of last question, but I first want to just give some quick advice about the two-step application process. So Project Horseshoe is going to move very quickly from the deadline for the October 15th deadline to when you would potentially be getting an offer for that award. Unlike a lot of fellowships, Project Horseshoe moves quickly. So if you are interested in this and you think you might want to apply, what I want you to understand is if you're going to apply by that mid-October deadline, you need to know in advance that you might be given an offer for the program before this calendar year is over. It might be early into January, but not too far into January. So what I want you to understand is at that point, you need to be prepared to be saying yes or no and feel comfortable about it happening at that moment. If this is your number one choice, then I absolutely want you to try in mid-October, and that is going to increase your chance of being selected to the program. But if, let's say, you're applying to Fulbright and Fulbright would be your number one choice, but you are still interested in Project Horseshoe, then frankly, you might want to take your chances by waiting to see if they still need to choose fellows for that second deadline that's going to happen in February. Because otherwise, what would happen is you might have an offer from Project Horseshoe before you even know if you're a semifinalist for Fulbright. And that might force you to feel like you have to say no to Project Horseshoe because you still don't know what's going on with Fulbright. And then if you are unlucky with Fulbright and that doesn't work out, then you're in a situation where now both of those things are off the table for you. But I also want you to understand, I cannot promise you that there are going to be positions available for that second deadline. I think that there will be, but there are just no promises to be made about that. So I hope everybody understands that. For the folks in the chat, do you have a last question that you would like to ask Ryley? Okay, it looks like that's no. If someone interjects, then we'll cover that question too. So I would just ask Ryley to just comment on, so, you and I worked very closely together on this, and I did my best to pitch you on this program and what it would mean for you. But I'm sure that we also talked about that there was a big leap of faith in accepting it and the change that would happen in your life as a result of it. And I just wonder if you could talk us through a little bit about what it's been like to make that transition to a community that probably doesn't look very much like any one that you'd lived in up to this point.
Yeah, totally. I think I had a lot of apprehension coming into this fellowship about, the change in a lot of things. First off, I had never really spent a lot of time in the South before. Definitely hadn't spent a lot of time in the rural South before. And so I knew that was going to be a change, especially compared to kind of the fast-paced environment that you have at a place like Northwestern. Not to say that this isn't fast-paced in its own way, but I would say in the way that it's different is that people have a lot more patience here. And so they are interested in taking the time to just get to know you, even if that's at the grocery store or just walking along the street. And especially because you are a new face, they definitely want to get to know you because they probably know everyone in the town except for you. And so that has been a really interesting adjustment that I've learned to really appreciate. Because I think for me, it shows that people in a small town like this really look out for each other. and are just really willing to take that time to make relationships. I would say that despite my apprehension of like a lot of unknowns going into this fellowship, I think what I realized, which is something that if this sounds like you, I would say definitely go for it, is that I knew that I didn't want to go to grad school right away because I still had some things to figure out about what I wanted to do. I knew that I wanted something that was rooted in direct service and on the ground experience of engaging directly with individuals, immersing myself in a community that I didn't know a lot about. And Project Horseshoe Farm just kind of seems like a really unique way to do that. And me personally, I'm interested in going into social work. I don't know what everyone's background is here. And if it's med school, then that's totally perfect. But I would also say that don't be discouraged if you're not interested in medicine. That's not necessarily my path, but I'm interested in all of the social contexts of health. And I've found even in the 2 months that I've been here that has been really the bulk of what you're dealing with when it comes to people's overall well-being. A lot of it has to do with mental health and the social services that they do or do not have access to. And so I think it's really fulfilled all of my expectations so far and gone beyond. And the things that you're challenged with here and the problems that people are facing here are completely different than anything that I was like seeing or experiencing at Northwestern. And so it really is, I think, a substantial but important perspective shift. And I've really, really liked it so far. And I think the other thing that I would say is a lot of times when I would tell people that I was doing this fellowship and it was in rural Alabama, they had a lot of negative things to say. And I think that this fellowship is a really good way to kind of see what a small town is actually like, and not kind of what it's kind of caricaturized, and that's maybe not a word, in the media, and to actually get to make one-on-one relationships with people that you definitely would not meet otherwise, and seeing how many similarities you actually have between them than differences. So that's been my kind of like awakening experience so far.
Well, that's really wonderful. I mean, personally, I'm very gratified to hear that. I'm happy that it's going well. I don't want to send anybody off to do something that they're unhappy with, but I think that your fellow Northwestern students on the chat and anybody listening to it at home will totally understand what you're talking about in terms of how different the environment outside of NU might be, but how enriching it could be for you to get that experience and to learn different ways of life, even within the United States. And so that's really great to hear. Okay, so first of all, thanks to the folks who came today. Huge thanks to Ryley. I feel like this is kind of a program that raises a lot of questions, and I think that we got a lot of really good answers for those today. Quick reminder that I am the advisor for this award. So if you have questions or want support on your application, I am here to do that. Don't hesitate to reach out. Reminder about the deadlines, October 15th, right? Ryley is the first one. And then the next one is February 4th.
Let me go check. I think it's February 18th, Sunday, February 18th.
Okay, so mid-October and mid-February. Okay, well, thanks everybody for being here today. And for those of you who might be applying, I hope I get the chance to talk with you and work with you soon on that.